Hello, my name is Dr. Soyini Hawkins. I'm a minimally invasive gynecological surgeon just out of the suburbs of Atlanta, Georgia. I take care of patients at the Fibroid and Pelvic Wellness Center of Georgia, and I am also an endometriosis patient. The medical side of me would, of course, tell you it has an incidence of 10%, right, of women that are in their reproductive age. But the patient side of me would say that it can impact every facet of a woman's life. It can impact their significant other, it can impact their children, it can impact their social circle of friends and family. It definitely is a disease process that's well beyond that 10%. So a lot of patients typically find out when nothing else makes sense. I was missed in my diagnosis because I had fibroids first. Fibroids are growths of the tumor. They were very easily seen on ultrasound. But even though I was going for my annual exams every year, I was never told I had an enlarged uterus. It wasn't until I started to have pain, which is the hallmark of endometriosis. And immediately my pain was attributed to my fibroids. I had surgery for it, and it was during my surgery that I actually got diagnosed with stage 4 endometriosis. So there are a lot of conditions that get mixed up in the diagnosis of endometriosis and will delay it. Some of the more prevalent ones are irritable bowel syndrome, PCOS, even though the hallmark of that is not necessarily pain. Some patients will get diagnosed with pelvic inflammatory disease. Some patients will be told that their fibroids are what's causing their pain, and I call fibroids a sister friend to endometriosis sometimes. And what we have to realize and recognize is these can all live concurrently. They can all live together. Patients need to know that shared decision-making is a thing. Shared decision-making means that you're having discussion, and it's a communal discussion of understanding and planning, and that your actual goals are taken into consideration in every move that you make with your doctor. No, you shouldn't have a medical degree and a deep clinical understanding of all of the nuances of the disease. However, in shared decision-making, that means that your doctor should at least be giving you a deep understanding of what's going on with your body. You should understand what your options are. You should understand the risk and the benefits and the alternative to those options are. You should understand that it is always appropriate if you feel like it's necessary to get a second opinion, because if your provider wants the best for you, even if the best for you is not them, they'll be happy for you to be getting taken care of. Shared decision-making is essential to our care as endometriosis warriors. The advice that I would give to someone that is new to this journey of endometriosis is advice that I did not get at the start of my journey, and it is that you are not alone. There is a community of women who can empathize with you, with what you're going through, can be a resource for options or even just a listening ear. The communities are vast. Find out locally what you can do to advocate for yourself or be guided in your advocacy for yourself, or maybe even give into communities that are similar to you. It was a very, very lonely journey for me pre-social media. And I think that if I would have had the community that's available to us now, I would have had some hope.